Good morning and good afternoon to everyone on the webinar today. As a leader in travel technology, Arctic IT is proud to share our latest software designed to help tribes make families thrive through our new family wellness application. With me on the webinar today is our pre-sale solution architect and expert on travel enrollment solutions, Brian Schmidt. Brian has been working in the travel space and with Arctic IT for 6 years, providing solutions for both tribal governments and enterprise. Without further ado, I'd like to turn over the presentation to Brian Schmidt. Thanks, Brian.
Thank you, Mary. I appreciate that introduction and welcome everyone to this webinar. Appreciate everyone taking the time out from their week to attend this session where we're going to walk through a family wellness solution that we developed on the Tribal Platforms platform that we make available as a solution for lots of different tribal customers, tribal governments. So before we get into the demo, I wanted to do a brief introduction. So I'll show you a couple slides introducing Arctic IT and in setting up the demonstration. So Arctic IT, if you're not aware, has been in this space working with tribal governments and tribal casinos for over 16 years, helping them with lots of different solutions that help manage their tribal organization. And we've had a long history of being a strong partner in working with the tribal governments and the IT department. Arctic IT was born in Anchorage, Alaska, but we have since expanded our footprint across the nation and actually have 6 different locations now, offices, and serving all the different states that are highlighted in light blue here, where we help tribal organizations. A little bit about our corporate leadership. Arctic IT is a Alaska Native-owned corporation owned by Doyon Limited, and our president, Aaron Schutt, and Julie Mormon is our COO. They form our leadership team that provide guidance to our leadership team at Arctic IT. Arctic IT has been a Microsoft partner for over 16 years. We've got core competencies in many different areas inside the Microsoft core products that they make available. We are a gold Microsoft partner, which makes us certified in many different areas and strong reference capabilities and making sure that we have the competencies and you can depend on the work that we provide to you in all these different areas of your IT and your infrastructure. We've done this before. We've worked with lots of different products in both Dynamics 365, Office 365, and Azure, deploying them in the cloud as well as on-premise for tribal government, federal government, and commercial clients. Now, what I wanted to do is do a brief introduction to Dynamics 365, which is the core platform on which we built our family wellness solution. So before we get into that, I wanted to just briefly ask about some of the struggles that you may be having with your current technology and systems that you have today. Sometimes you're either using paper and pencil or Excel spreadsheets to track your data, your family wellness information, and sometimes that information is siloed so that you don't have a good way to share that information or reference information from other departments. Many manual processes are very, very common, and reporting is quite often very manual, requiring you to assemble the data by hand and distribute that within your tribal department and also for the tribal council. And security issues are a top concern to try and protect the information due to the sensitivity of the data that you're working with. So this is some of the core issues that we hear from tribal organizations that provide family wellness and family and child services to their tribal members. So what is Dynamics 365? It's an integrated cloud platform delivered by Microsoft that provides the capability to unify customer relationship management or contact information along with financial and the enterprise resource planning, ERP, capabilities to aggregate all that data across the organization into one intelligent, secure platform. Plus one big benefit is having a common data model. Then all of a sudden you can have one list of contacts or accounts, for example, that can be managed across the different organizations or different departments. And when address changes happen in one place, they are available to everyone. So that's one big benefit of having a common data model. But then it also integrates to Microsoft Azure Cloud and Office 365, which is a great integration capability. So Arctic IT has chosen Dynamics 365 as a platform on which to build our tribal platform product and we've specialized in delivering solutions for tribal governments and enterprises, including tribal platforms enrollment, community solutions such as per capita payments, family wellness, education. And we've helped many organizations with their accounting, as well as upgrading and helping to maintain their current finance and accounting procedures. We also have a shareholder platforms records management solution built on this platform that is targeted for Alaska Native organizations that perform dividend distributions for their members. So what are some of the benefits that you can recognize? Having this member master database is a key benefit of using the Dynamics 365 platform. In the same way that you have a common data model, we extend that to be a member master database so that you can have one destination for all your core member data, address, names, services that are being provided, and be able to secure that information using the relationships to make sure that different departments have access to data that they have permissions to see, but also being able to see other information that will help streamline and secure the information that will help them be more efficient. And that is used to ensure cross-department policies. So for example, at the education department, they may have a policy with the enrollment group that if an address change arrives for a tribal member, that they have permissions to be able to update that address for the tribal member. And or a housing department, they may not have permissions to update that address. They'd have to submit an application request to change that address. So there's policies that this platform can support in whatever fashion those are presented to help you enforce those interdepartmental processes. And then data security is a key element of this platform in the sense that data security is role-based and field-based so that you can have an individual that is an enrollment role and they have full access to read all the enrollment information. And you may have a family services team member that only has access to the family services data and the case information related to those individuals. And you want to be able to share some core pieces of information from the member master, but the rest of the data is very private and you want to keep that secured. And there's a strong model within the Dynamics 365 platform to enable that scenario. Business rules and workflows are a great way for organizations to enforce those policies and make sure that when a process is completed or a milestone is reached, that workflows and business rules are making sure that the data is consistent and notifications are happening as they should, either automatically or in the database itself. And there's great reporting and analytics capabilities within not only the Dynamics 365 platform, but also within Power BI. So a little bit on tribal platforms enrollment. Again, this is a centralized tribal member master database, and this becomes a foundation for all the other different programs. So typically, we'll encourage a tribal organization to implement an enrollment solution, get the tribal platforms enrollment in place, to get the tribal member master database in place, and then start rolling out other programs to other departments. But enrollment allows you to manage the blood quanta and enforce the rules of who is a member, and then generate the ancestry and family tree history so that you can ensure that those people that are eligible to be members are following the rules set by the tribal council. We also enable the ability to print ID cards and in multiple different formats, whether that be youth, adult, or senior. You can have multiple options there. And soon we'll be coming out with a per capita payment add-in to enable that ability to process payments and integrate into your financial system to automatically and streamline that distribution process. And then, of course, what we'll be talking more about today is the family wellness solution, which tightly integrates to the enrollment platform. It's intended for a different user security role, which supports the ability to process financial assistance programs in a flexible way to define the eligibility for those programs, manage the substance and domestic abuse incident and case management. Child protective services are a key element to be able to make sure that if protective services are being provided, that they are being managed and who are the kids and where are they being placed. Family wellness plans gives us a mechanism to provide counseling, and how are we helping the whole family improve their well-being, not just the individual, and how can we engage the rest of the family to help an individual that might be struggling through that counseling process. Plus, we have lots of other options here, as we notice, for ICWA tracking, but also for group program participation, so that you can have great reporting to your tribal council, so that you can say, here's a program that was initiated, and be able to manage the budget and who is participating in that program. And obviously, member record PII, which is personally identifiable information, is really an important element of this because of the sensitive nature and the confidentiality that's required for the family child services. So that is a key requirement for this solution, and built in to make sure that the data that's created here is not visible to anybody outside of that family and child services group. So with that, I will switch into the demonstration of the family wellness solution, and to give you a brief introduction of how we provide that capability. All right, so as you can see, what I'm doing here is I'm actually running inside a browser. I'm using a Chrome browser today, but this could be any type of browser. This could be Chrome, Edge, Internet Explorer, Safari. Any of those browsers are supported on just about any device. So this system is available to you in a cloud-hosted environment in such a way that you can access it from either your desktop in the office, but you can also access it from your tablet or your phone. Actually, you can pull up the same browser page, and as you see, I can resize this window, and you'll notice that the page reorients itself to the size of the screen that's there. So I can make it really big and it will take advantage of the space, or I can make it really wide if I'm in the scenario of a tablet, and it will reorient the information in a way. So that's what they call a responsive design, to be able to handle any type of device and also be able to bring this data on the go when you're in a mobile scenario. So this is what we call the dashboard. It's typically the landing page, and this dashboard is very configurable. You can see that I'm logged in as an individual user. So Dave Bailey is the role that he has is a person that is on the Family and Child Service team, one of the caseworkers, so that I've got a view that allows me to see records that maybe either the whole team is working on, or I can filter this to just those records that I've created, so that if you want to protect the information or the case or service requests that are being created, based on its type, we can also accomplish that. So from a navigation, you can click on these options to navigate to the application. So you'll notice that there's a family wellness, but because this is integrated to enrollment, you may also need access to some basic information for the contacts and the list of people in the organization. So I would be able to see this if I had permissions, at least read permissions to be able to see the list of contacts, but I wouldn't be able to see any information, and that's any information related to the membership or the blood quantity details. Data that's very private to the enrollment team is kept hidden from the Family and Child Services team, but yet exposing other information that is permitted by your team to be shared between the two departments. So this is how you literally switch between the two different applications within the system. So one thing I wanted to point out is back on the dashboard is I can look at this chart, and I can actually pop this out or view the records. So that any of this information is actionable. So I can look at this list and I can see that there's 32 contacts in the system. And if I click on one of these bars, it actually filters. So these charts and graphics that are available to us are active and are responsive to where I click. And if I only want to see the minors, for example, I can click on those areas and set those filter results and look at information that way. So the dashboard is a great way for you to be able to navigate and extract information. And you can also get at it just from the list. So I'm looking at the contact list, and I can have multiple different views. So I can see only those contacts that are living that might be members. I might want to filter this group by gender, so I can see, which ones have not specified, and filter the results by just male or female. So you can have great navigation and filtering capabilities within the system. So another option here is you can see that I can see just those that are available to me as family wellness active contacts, meaning those are the people that I'm actually providing services to. But I can also have access to other views. So and these are configurable and defined by you to adjust. So you can see I want to filter out only those people that are members of the tribe. So I can make sure that I'm only providing services to just these people. And then if you want, I can actually take this and export this to Excel, kick this out into a static or a dynamic sheet that allows you to slice and filter the results that way. There's many, and you can actually, as an end user, you can actually create new views. So such as like, let me come back here and I'll go to active contacts. And I can actually just do a quick search. So let's say, for example, I'm looking for a blue family member. I can search by this, so it'll filter those results. Or I can say, all right, I know a portion of their tribal ID, so I'm going to do the star in front of it, and it will come back with both the individual, their tribal ID. Oh, but you'll notice here that it found another individual. Oh, there's that 877s because their phone number. So there's a very flexible and strong search capability to allow your team to find the records in a very quick and efficient way. And this is one of the key advantages of using the Dynamics 365 platform to provide this capability to filter and search on the data in the system very, very easily. Okay, so one of the things you would do as a family wellness organization, first thing you're going to do is come in and configure the programs, for example. So one thing you might do is come in here and say, okay, I've created some sample programs in the system already, and these are configurable by you for the specific programs that you make available to your tribal members. So for example, you might have emergency assistance, you might have burial assistance, you might have educational or laptop programs that you create. I'll click on this emergency assistance as an example. So you can use this as a way to categorize the type, the description, if there's some exclusions that apply, create the budget that applies for this program, the start and end date. So you might want to report on, the list of the individuals that have actually participated in this calendar year, and you might want to change these dates, right? If there's a program manager related to this, and then you can actually keep track of the remaining funds. So you can see that there's been 4 total service requests, and then there were 3 assistance requests related to that for a total payment of $1,250. So this can be a running total that you can use to manage, or just an overview of that program. We use the program criteria as a way to define what are the requirements. So for example, if this program is only available to a tribal member, you can set that and that becomes a criteria in the system that will require that when you select an individual or an individual has applied for emergency assistance, you can confirm that they are a member before you actually grant them the money. And in this case, you might want to restrict this funding, this emergency assistance, to just members of this tribe. But I could leave it blank to mean that, it could be any tribe. They don't need to be a member of my tribe. As long as they're a member of any tribe, they might be eligible. But this gives you a way to set the criteria depending on the type of program. And these are very flexible rules that can be adjusted for your program. So for example, in this case, they have to be 18 years old. If there's a maximum, we can enter that here or leave it blank. If there's a gender requirement or age group requirement, you can set that to any, for example. And then when we save this, this will now become available for all the programs or the participation requests that come in to apply for this emergency assistance. And because this is a list of the program, what this does is it captures any of the assistance requests that have happened in the past that have been processed. So right now we're seeing that there's 2 active that are in process. The other 2 are obviously closed out because they were assistance was provided, so we close them. So those are removed from this list. We can add them to that list depending on that criteria. And because this is a financial assistance category or type, this will list all the different types of assistance requests that have come in and be able to summarize the results, based on what month. And we could adjust this view that is shown here so you can say how much money has been provided over the last few months. But this is a great way for you to be able to do reporting on the information inside the system and keep track of who are all the people that are participating in this program. So there's a great way to be able to take this information and export this, right? So I can see, here's a list of all the payments, and I want to kick out an export of all those lists of payments that have been made for historical reasons for that year. And then the next year I can create a new program to track applications and people that have participated in each of those programs. And again, you can have, child protective services. You can have this type. So you can, right now we've defined this set of categories for the programs, but this is in a flexible list. So it can be adjusted to the names of your programs, or if you have additional categories of programs that you will make available, you can use this as a way to configure these specific for your organization. All right, so let's go back into the family wellness. Now we'll talk about a little bit about the contact. So we'll pick on Alicia here. Now, again, as I pointed out earlier, this is information that we're making available and sharing between both the enrollment department as well as the family wellness team. So based on our policy, we're allowing both those teams to be able to access pretty much everything on the contact. But you'll notice here, for example, that this member profile is blank, and the social security number is blanked out. This may be a mechanism as a field level security, and that's what the lock symbol means here, meaning that in this role, I don't have permission to see this. And I'll show you another example of what that would look like for a different, so now I'm logged in, I'm just switching gears to a member that's, this might be an enrollment person. So now you can see that information is unmasked, and then this tribal member profile is actually listed here. So this is a way to be able to keep that information segregated by role, because right now I'm logged in as a different user, and I can access and see all the information related to their membership details that typically are managed by the enrollment team. So I'm going to switch back now to the family wellness, and I'm logged in as Dave, which is a family and child services. So as you can see again, that this is masked. That's a great way to keep the information secured and managing what is a permissible, or by policy, who can edit what within the system. So for example, you'll see that we can track the vital statistics such as their birth record or death record, their race, ethnicity, and then their tribal membership details. So which tribe they're a member of, their ID, their member status, and if they have access, they can see their CDIB details. But in this case, we don't. Then we have a flexible way to show their contact information. So there can be an unlimited number of addresses. So they can be either home, mailing address, seasonal address, many different types of addresses that I can use, and this can actually be an address history. So if the individual has moved multiple times, this will show that history in a reverse chronological order. So you can have access to that and see that detail in the past. And then their electronic contact information, maybe their email or their phone number. This is an easy way to maintain their current phone number contact information so that it is available at your fingertips. And then, of course, you could capture all sorts of other information, their physical description, name. So, for example, the physical description, this would be printed on your ID card if you want that there. You can keep track of their education or skills, certifications, emergency contacts for the individual. But we also can keep track of, for example, their monthly income. So if you want to use this as a way to manage their eligibility for different programs, you want to be able to capture what is their wages, what are their loans, expenses. Maybe this is a car loan, maybe this is their rent, and is there other expenses that they have? And maybe she's receiving some child support for the kids. So you can use this as a way to enter the data and then verify total income, their total expenses, and then use that as a criteria to establish eligibility for different programs. So this is a really flexible way to manage the data for the individual. Now, one thing with the contact details, we have the ability to define what's called a family group. So a family group may be different than a household. I mean, you know, these are actually members. So in this case, it's Alicia and her 2 children that she's responsible for. You can see that relationship and how many total family members. And this is a way to establish eligibility. So if you have programs that you say, okay, they must have at least X number of family members, you can use this as a mechanism to establish that. Let's go back to her. And you'll notice as I'm clicking on the links, anything that's on blue is a hyperlink. So that's how I'm using the Dynamics 365 system to navigate around the system. So anything that you see that's in blue and the icon turns into a little finger, you can see that it actually is navigation. So I can click on that link and it takes me to that record. So in the family wellness system, we actually use the client profile as a place to manage details that are private to the Family and Child Services team. So you can keep track of all your notes. For example, I can create appointments, emails. I can generate an email from here. If I take in a phone call from Alicia, I can capture the comments or notes from the phone call, or I can just generate a new note. So I can use that as a way to capture details. And then you can see that it's sorting it in reverse chronological order. So I see the most current requests or notes on the top. And then you see a quick view of their eligibility. So both their age and their total income. And this would be used elsewhere as we determine eligibility. So you might use this as a way to keep track of their primary medical, who is their provider. So I might say that the Alena Health Clinic is their primary provider, who is their pharmacy. If they have an insurance provider, you can capture their insurance details for reference. And then this is an easy way to keep track of their service requests. So you can see all the past history, whether they've been approved or whether they have been denied. So you can keep track of if you got somebody that requests assistance frequently and they repeatedly are denied, you can see that whole history to have that conversation with the individual. And then you can see from an individual standpoint, plans, if there's any plans, goals related to this individual. And then you can see their payments, all the past payments that have been made, either to someone else. So in this case, it was a payment that was applied or paid on her behalf for some educational assistance, and you can see the amount and when that happened. So there's some really cool relationship. This is where the relationship terminology comes into play, so that the records are related to each other in such a way to make the information discoverable across the whole system. Okay.
This is an incredibly robust system, Brian.
Thank you. So yeah, if anybody has any questions, please type into the chat window, and Mary will stop me and we'll try and answer that question as I come up. All right, so now let's step into some of the service requests. So this is simulating an intake. So for example, we've got a case where Alicia is coming in and we've got a history of all the service requests that have been received by our tribal members or non-members. So this service request, for example, she's asking for some employment assistance. I've been unemployed, I need to find a new job. So I'm relating it to her as a client profile, and her family group shows up here, and I show a summary of the information from when I select this. So I'm not entering this information again. Just by the fact that I'm updating her family group or I'm updating her client profile, all this information comes along with it, and I don't have to re-enter that information on each service request application. So I'm literally just going in, picking the individual, selecting the date and what she's asking help for. And in this case, she's asking for counseling assistance and she's asking for career counseling. So we're relating this to a program so that you can track those requests as they come in. And then you'll see that once I select that program, all the eligibility requirements show up over here. So for example, this was a case where this is for adults. There's no funding a maximum. There's no recommended funding. So it's pretty much open and it's available to anybody for this type of counseling. So obviously, as I scan this eligibility requirements, Alicia is eligible, so I change this to yes, and I mark her as approved, and I say who approved it and when, and then who is going to be the caseworker that's going to be working with her as she's going through her career counseling. So what that does is it drives into this the actual counseling requests that happen along the way. So let's go into that counseling case plan. So we create that here as here's our career counseling. We have related to the family group, and it summarizes the information from that service request so that it appears here. And then we can capture what is the situation today and what is our long-term vision for being able to become more self-sufficient and get a better job for herself. From there, what I do is I actually create this plan overview. And because this is the actual case plan itself, and what this does is actually shows the full picture. So because right now these are two minors, there's no client profile, they're not going to be part of that counseling per se, but I can actually click on the Alicia node right here, and it filters the results. You'll notice that grid down below changing view. So when I'm filtering on Sam, there's nothing related to him right now. All the records are related to Alicia. Or I can click on the whole family group, and if I have records associated to anybody, those will show up there. So for example, this would be a way to say, okay, I'm capturing this as a goal for her she wants to develop office manager skills. So I can open, or I can actually go create that goal or that case note. So for example, she wants to develop her skills, the objective, and what the outcome might be, and then be able to manage the progress. So you can say what's the next review date, and then capture any assessments. So I can create an assessment, and I'm going to say, I'm going to do this today. Miss Wilson right here. So now you'll see that because all this information is defaulting from her client profile record, what I can do then come over here is into the assessment. And now this again is a page that's designed to be adjusted specific for your organization. So for this type of assessment, we might have different, what's our family engagement? So we can adjust these fields and these options based on this specific assessment type and be able to say, okay, she's unemployed right now, she needs skills training. So we just met with Alicia, and this is where you would capture the details of that conversation, that counseling situation and meeting with her. Okay, so I can capture all these details here. And then one element of this is that because I'm doing this assessment, I want to be able to track the amount of time that I'm spending with the individual. So I didn't actually travel for this, but I did spend 30 minutes with her. So now I can use this as a way to summarize not only how much hard physical dollars I'm providing to an individual, but I can also track how much time I'm actually spending. So if you've got one individual that's coming in and requesting lots of different services from your department, you can actually summarize the actual time that was provided to an individual. So I'll actually refresh this. So now you'll see that that ops manager assessment was captured and the date that it was added to the list. So this is a great way to filter the results and see everything that's been processed through the family wellness solution. And also one of the things we can do is actually, let's go in here and actually complete this activity. Well, let's just deactivate it. So now what we'll do is we'll say, all right, we completed this assessment. We don't need to track this anymore. And I'll refresh this page. And now you'll notice that marks as green. So it's marked as inactive, but that's a completed activity. So as you complete your work related to this case plan, then you can use this as a way to say what is done and what is still outstanding. And I can actually hide those that are completed. So I can hide and show those results very, very well. All right, so let's go to a different plan and show you a little different view. This case plan is around addiction counseling. So the Blue family is dealing with some alcohol addiction, and we're trying to manage, how do we get Jeremy alcohol free? And we need him to get a job so we can manage the goals and the outcomes to manage how are they actually progressing? Are they achieving the goals that we laid out for them? And capturing all the details of the assessments and the case notes as we're going through the counseling for that individual. So this is a great overview to be able to see that there's not only is John having issues with alcohol because we're providing counseling for that individual, but it also is another family member that is getting counseling. So this is a way to say, okay, Susan, Brooks, other family members, what are we doing to actually provide services? So we might be showing, let me click on Susan as a note to say, you know what, she's receiving counseling just as a spouse, trying to deal with the situation and coping mechanisms for her to be able to help her family do a better job of dealing with their addiction and ways that she can help guide. So again, this is capturing counseling notes, details of that conversation, and then as those activities get completed, they can be closed out as well. But you can see and click on these nodes and see all the related activities to the individual, but then click on the whole case plan and see all the activities related across the entire family, whether they're phone calls. And you can see on this activity type that you can have appointments, you can set up appointments, you can set up assessments, set up emails, that you can be generating emails using templates from the system. And that could be if you're doing a referral or doing an assessment appointment, you can actually use that as a way to remind the individual that they have an appointment set up. Or you can track phone calls that happen, referrals, or tasks. These are the kinds of examples, activities that you can relate to this case plan. Now, one thing that I do want to point out within this, so let's go, for example, into the service request. There's the ability, let's click on this blue addiction services. There is the ability to also keep track of the audit history. So for example, if something happened to this request and somebody accidentally edited a field and made a mistake, you can actually see, what the old value was, what the changed field, and what the new value is. So there you can see who did it, when, and what was the event, whether it was an update or a create activity. So the audit history is a great way. If there's an issue or something accidentally gets overwritten, you can edit that record. And then you can also attach documents. So the document attachment actually uses the Microsoft SharePoint environment to allow you, if there's a document or a guide or something you're providing, or evidence of the counseling or evidence of some document that you want to scan and attach to the service request, this is where you would actually upload this document. And it actually shares the documents on SharePoint in a secured area, so that they would be only searchable and visible by the family wellness team. Okay, So within, the case plan, we can create all these. Let's go, for example, so I'm going to simulate this scenario of this Julie domestic violence situation. So she came in, and she's part of the Reed family, Julia Reed, and here's her details. Came in with Maria, her daughter, and there's some spousal abuse allegations. So she's requesting counseling and some protective services. And so she's eligible. Obviously, there's very little barriers to be approved for this type of counseling. So we're saying, yes, she's approved. She's been assigned Dave as a caseworker. And in this case, what we're doing is we're actually capturing an incident. So in this case, let's go in and dive into that incident report. So when she came in, she told us, the date of the report itself, the time that the incident did happen, and the incident type. So you can have a flexible list of many different incident types that you can adjust and change over time. You can say, okay, who were the victim or victims? There can be multiple. Maybe this might have been reported by a police or reported by a hospital scenario, and then you can list the alleged offenders. And then this might be a spouse, and you can see that, have that relationship type here. And then you can capture details of the investigation. So if there's an assignment of who is that primary investigator, is there a police report, yes or no? Are there photographs or other evidence associated? And then this would be family violence. So that we can say, and physical abuse. That might be and we don't know if there was substance abuse involved in this situation. So we can actually use this as a way for police or others to actually capture details. So I'm going to save this and then create an investigation that goes into this. So I can say whether this is a social worker having a conversation with that individual, and then we can say the date. Let's just pick a date here when that happened, and we'll save that. And then you actually can capture the notes here. And then this could be detailed notes from intake meeting. And then if there's any additional phone calls that happen or emails or tasks or appointments, you can capture those details on this timeline. So it shows up on that investigation. So let's go back to the incident. And then you'll see that I can create as many investigation reports in here as I need, so that if there's multiple evidence, so social worker provided input as well as police report, you can capture both of those as record. And then obviously, because there was children involved, maybe the situation here was she was injured in such a way that she needed to go to a clinic or a hospital. And then I can actually say, okay, Maria, their daughter, needed to be placed in temporary foster care. So we can say, okay, well, this was the incident that created the situation, and we're putting her in temporary housing. And where is that individual going to be placed? So you can have a flexible list of approved placement locations, and you can use this also as a way to verify let me click on that placement location. And you can use this as a contact details. How many kids are allowed in that facility? And then this could be the list of all the kids that have been either currently are placed in this foster care facility or are passed and have been returned home. So this is so the foster care, and then you can put a date or an expiration on this situation. So then you can track those placements and where that happened. Okay. We also have the capability to capture and process ICWA notices and that have either received from other tribal organizations, and so that you can manage the investigations that go along with that to show that the child is eligible for an ICWA placement, and then track the records related to the ICWA placement. One thing I did want to go back and some of the reporting, in addition to the charts and dashboards that are available, one thing I did want to point out is have a plan summary report. And again, this is very flexible and we can add other types of reports in the future, but this might be a way to capture some basic details about the plan and then be able to present this to the individual, the Blue family, around, okay, here are some goals, outcomes, and track other activities that would be related to this case plan to help them manage the case activity in the past, but also some upcoming work that's happening. All right, so with that, I think that was the last bit that I wanted to touch on. There's some really great capabilities that I haven't gone through, but as you can see, there's a lot of capability here for the Family and Child Services team to manage all the data that they have within their organization. So with that, I'll open it up. If there's any questions that people want to type into the chat, we can try and get a few of those questions answered.
Well, once again, a very thorough application that covers so many facets to healthy lifestyles and serving families within these tribal governments.
Yeah, thank you. Not seeing anything. Are you seeing anything, Mary?
I'm not either. This would be a great time then to say thank you to everyone that has joined us today on this webinar. And if you have any questions, of course, Brian's contact information is there. He is the expert in this field, and we're really glad that we were able to tap into his expertise today. So, Brian, thank you.
Yep, thank you, Mary, and thank you everyone for attending, and look forward to furthering the conversation of how we can help your tribal organization and your Family and Child Services team deliver services for your tribal members. Thanks again.
Thanks, everyone.